Okay, let's get started. For those of you who don't already know me, my name is Michelle Walz, and today's presentation will be about um, easing your back pain. Um, this is me. I'm a physical therapist here at Heart of Wellness. I received my training in my home state of Minnesota at the Mayo Clinic and have been practicing for over 20 years. Really over, as of recent, probably over the past 10 years, a lot of my continuing education has been focused um, in the arena of yoga and mindfulness, and really enjoy infusing those modalities or those practices into treatment with patients. I'm also certified as an integrative life coach. So that's a little bit about me. Um, so really this presentation today is about back pain. And you're probably here because you may have experienced back pain at some point in your life, and you're not alone. Really 60 to 80% of adults will at some point in their lives experience back pain. And there's a lot we can do about back pain. Just because you've experienced back pain doesn't mean you're destined to experience it forever. There are a lot of things we can do to help ease pain in our back. I thought I'd go over starting this presentation about a few things of what causes back pain and kind of a little bit behind the anatomy of our backs. And then we'll talk about a few strategies of things you can do to help manage your pain. So what causes back pain? Prolonged awkward positioning or repetitive activity. Our bodies are designed to move, but they're really not designed to do the same thing over and over and over again. And in our society these days, one of the things that we do repetitively or for prolonged periods is sit. So these are things that can lead to back pain over time. Imbalances in our body, mainly an imbalance maybe in your flexibility and or strength. This can lead to back pain. Traumatic injuries, of course, can cause back pain. Car accidents, maybe you have fallen or lifted something and it was very clear to you when that injury happened. Degenerative changes that can take place slowly over time can also lead to back pain, as can structural conditions like scoliosis, osteoporosis, congenital anomalies. Some people are born with a few of their vertebral segments fused. And other autoimmune conditions like fibromyalgia, ankylosing spondylitis, things of that nature. This brings up the point, I am no stranger to back pain. I do have ankylosing spondylitis, and I've learned a few things not only as a physical therapist, but as somebody who lives with back pain and how to manage that. So I love this slide because wow, you look at the human body and it's just amazing. There are over 600 muscles in our body. Look at this picture. I mean, there's a lot going on there. It's really remarkable, the intricacies of our system, just what it takes just for us to take a step. But when it comes to our lower back, which is what we're talking about today, you can kind of see there's some pretty large muscles on the backside of our body, and some of them start all the way up in our shoulder and attach way down at our waistline. Muscles in our legs cross our hip joint and can affect our back. Muscles in the front of our legs, muscles in the back of our legs, our hips. So you can see, I included this picture just to show you how intertwined all these different muscles are working in our body. And this picture isn't even showing the fascial system, which covers the muscles, which something that goes on in your neck could affect your lower back. It's really all closely related. So then we peel away the muscles and you get to the bones of our body. And when we talk about our back, we're thinking about our spine. Our spine is really a column, and there are 7 cervical vertebrae in the neck area, 12 in the thoracic or like the mid back area, and then 5 lumbar or in the lower back. And you can see here, there's a side view of the spine. And what we'll see is that they're not only just bones stacked on top of one another. You have these cushy discs in between each vertebrae, and they're shock absorbers. So we have the discs in between each vertebrae. And then you can also see in this picture here that there are nerves coming out through this little hole on the side here. And those nerves, when we're talking about our lower back, those nerves travel into our legs. And so if there's something going on with this disc, maybe the disc is, it's had some wear and tear over your lifetime, and maybe it's not as plump and as tall as it used to be, those nerves can get compressed. Or when we're a little bit younger, that disc can even protrude a little bit and put some pressure on those nerves, and we can feel the symptoms in our legs. So there's, again, there's a lot going on there. Usually things are in pretty good working order. But just a little bit about what kind of lives in our spine. And if you look at it from the side here on this other picture, you can kind of see there are some natural curves in our spine, curving in a little bit at the neck and then out in the mid back, and then curving back in the lower back. And then you can see coming down, this is our sacrum, which at the bottom is our tailbone. So these curves we need to have kind of one affects the other. Again, this is a column, right? So ideally we have these natural curves, and there are things that can affect that. And I mentioned earlier in our muscular system, some of the muscles that can be tight, maybe on the front side of your hips, will pull the pelvis forward and exaggerate this curve in your lower back, leading to strain. Or maybe the muscles on the back side of your legs are tight and they tug on the pelvis, tipping the pelvis backward, reducing this nice natural curve in our lower spine. So we want these curves to be as neutral as possible. And really, our body is designed in a certain way, to work in a certain way, and to live in balance. A lot of people will come to me saying they have back pain, and it's hard to distinguish sometimes where that's coming from. The source of the pain could be truly in your lumbar spine, which we just talked about, in the area of the vertebrae or the muscles surrounding that area. But sometimes what we consider back pain is actually coming down from in the pelvis. You may have heard of your sacroiliac joint or SI joint. That can feel like back pain. That is coming down from lower in the pelvic area where this sacral bone and the iliac bones come together. And also the hips, stiffness or degenerative changes in the hips. Sometimes you won't always feel the pain right at the hip itself. You might be feeling back pain, or vice versa. You might feel a lot of pain in your hip, but it's actually stemming from something going on in your lower back. So really, when we're talking about our lower back, we're talking about the lumbopelvic hip complex. These things all kind of working nicely in concert together. Okay, there's some anatomy, and I just had to throw in my little cutie dog Summer just to break it up, so we're not getting too deep into anatomy. And I truly believe that smiles are contagious. And look at that smile. That's pretty contagious. So we talked about the muscular system. We talked about the vertebrae and the bones in our body and how closely intertwined our lower back, pelvis, and hip are. Really, what our back, for a healthy back, it requires balance. Balance between flexibility and strength. You can have people who are really, really super flexible, or maybe even over flexible, or what we call hypermobile, and they don't have adequate strength. Or vice versa, you can have somebody who's really, really strong, but not really flexible. So for a healthy spine and a healthy back, we really want a balance between flexibility and strength. And you'll notice the word balance on here multiple times. Balance between different muscle groups working together. Some muscles, sometimes in our lower back, muscles that surround the spine will be working too hard to try to stabilize our spine because maybe your core isn't strong enough and doing its fair share of the work. Or maybe your hips are weak and they're not doing their fair share of the work. So your lower back muscles feel like they have to do all the work, leading to pain. Um, we have muscles in our body that are designed to move, right? That's how we get around. The muscles move our body. But there are some muscles that don't really move our body, and their job is to just stabilize. And so we want a nice balance between the larger muscle groups, the movers, and the deeper stabilizers that help hold us steady. When we're looking at balance, we're also looking at balance in our nervous system. Our nervous system is what ultimately generates pain. And so if our nervous system is really dialed up to be really on high alert, this can lead to more pain. Or if our nervous system is really overactive, we can have really nothing going on physically in our body as far as we look at x-rays, MRIs, things like that. And the doctor's like, I don't know, I don't see anything on here. And sometimes really high levels of protectiveness in our nervous system can lead to pain, or it can feed our pain. So it's also important to have a nice balance in our nervous system. And then lastly, balance of all of our systems. And this kind of goes hand in hand with the nervous system, but our mental, emotional, physical, and spiritual systems, our bodies require balance, I guess. You can remember one word: balance. Not balance like standing on one foot. Balance throughout our system as a whole. So let's say you've injured your back and maybe it's taking a long time to heal and you're not sure why. Things that impact our recovery from injury. This is just a short list. There are many others that I'm sure I've neglected to add, but here are just a few. I already mentioned how stress and anxiety can impact our recovery. So it's really important to find ways to manage your stress and anxiety in healthy ways. Nutrition, what we put into our bodies, the fuel for our bodies, is also very important when you're healing. Well, it's important all the time, but especially when you're healing from an injury. Sleep is when we heal. Our bodies need adequate rest to heal. So proper sleep hygiene and things that help you to get a good night's sleep are very important. Things that can impact our recovery or slow our recovery are continuing movement patterns that really are less than optimal. So it's really easy to create, to compensate. When one thing isn't working well, our body is really, really good at finding a way to make it work. It's not how it doesn't always look pretty. You know, we might hobble around or move in really kind of awkward ways, but our body finds a way usually. And this usually works for a short amount of time, but if continued on and on and on over time, this is when it can lead to pain and dysfunction. So if we continue moving in these inefficient ways, it can keep our body from healing. Our beliefs impact our recovery. I tell people all the time to choose your thoughts wisely. Every cell in your body is listening and responding accordingly. If you are thoroughly convinced that you are destined to be in horrific back pain the rest of your life, you probably will be. So our thoughts are very powerful. It's not the only thing that affects our pain experience, but it is a thing that affects it. And if any of you out there are doctors, I'll encourage you to choose your words wisely, because sometimes it can be really scary when you go to see a doctor and they take an x-ray or an MRI and they're like, oh, wow, this is really bad. And you're like, oh no, right? So if that does happen to you, I'll just encourage you to stay calm and like just know sometimes it, not everybody's very savvy emotionally in relaying information to a patient, and that can be really scary. So I'll encourage you just to stay calm, even though something sounds scary. Um, because this next point is when we're scared, we tend to kind of curl up in a little ball and not move because we're afraid we might make something worse. And then we move less, and this leads to deconditioning. We get weaker, we're less flexible, things stiffen up, right? And this is a cycle that can just persist and carry on until we know what is safe to do and what we can do about it. I mentioned this a little bit earlier, hypermobility. We can be super duper extra flexible. Some people are born with joints that are hypermobile. And I work a lot with people who are hypermobile. This might require a little more tender care and a little more gradual approach. And hypomobility is just those people who are really kind of stiff. You're like, I've never been able to touch my toes, right? So I don't expect if you are one of those people that we're going to get you super duper flexible, but there's always room to grow. So, what can you do today to help with back pain? First and foremost, move your body. We do sit a lot more than we used to in society, especially if you have a job that's sitting in front of a computer, right? So, one thing you could do is schedule yourself breaks. I have a lot of patients who will even set a little timer on their phone or on their computer for every 30 to 60 minutes, getting up to move around. We're not designed to sit for long periods. That's not what our body's made for. So setting a timer, get yourself up, even if it's just standing and doing a few rolls of your shoulders, right? Or standing if you're at work, getting up and walking to the printer, or going to fill your cup with, go get a glass of water. Getting up to move has tremendous benefits for our back. Along those lines, avoiding prolonged positioning of any kind. Standing still for long periods can also be problematic. So this is where pacing would come in. If standing for long periods is problematic for you, you might, let's say you're cooking a nice, healthy, whole foods dinner. Um, if that's the case and you standing for long periods bothers you, you might just pace yourself. Uh, Chopping a few vegetables, setting them aside, go for a short little walk, even if it's just down your hall. Or laying down, stretching, anything to break up that prolonged positioning can be very helpful. Walking is some of the best medicine for back pain. But for some people who are in back pain, walking hurts. And so, if that's the case for you, you might consider using walking sticks or trekking poles to help unload your spine a little bit. Just a little bit of walking can be really beneficial. And where I see people get into trouble with this is doing too much too soon. If you haven't had a walking program for quite some time, I'd encourage you just to start by walking around the block. You can always add more, but if you do too much too quickly, you've already done too much, right? I really like the analogy of a seedling or the metaphor, like picturing a small little seedling that you've just planted. And as it grows, it's vulnerable and it's not very strong yet. Think of yourself in the same way, like this seedling. You're going to start with just a little bit. And then as you grow a little stronger, like this plant that we're thinking of, you can withstand a little bit more. So it's this slow, gradual build in activity or walking rather than a lot of walking. And then you're like, oops, I did too much, crash. And then you're sore and you're miserable and you can't do anything for a few days, weeks, or however long it takes you to recover. So if you take this slow, gradual approach, it's much more sustainable. For sleeping, I mentioned how important sleep was earlier. Sometimes getting comfortable when you're in back pain, it's hard to get comfortable in bed. You might try, if you prefer lying on your back, you might put one or two pillows under your knees. And this is just helping to keep your spine in a more neutral position. Or if you're a side sleeper, when you're lying on your side, putting a pillow between your knees. Personally, I have found that if you're on your side with a pillow, the smaller pillows, like you would put on your couch, are a little easier to manage than a big full-size pillow. So that's one thing to try. It can make a really big difference. Breathe. What do we do when we're in pain? We hold our breath, we tense our muscles, right? So even scheduling in short bits in your day to take a little breathing break. So as we're sitting here now, you might notice your breath. And think about your breath having this soft quality to it. So that as you breathe in, there's this soft expansion through your belly, through your rib cage, chest. And as you breathe out, just a soft release. And you could even imagine, as you continue to breathe, allowing your breath to expand into the backside of your body. What would it feel like if you were to allow your breath to expand gently in through the backside of your rib cage? Or allowing your breath to reach into those areas of tension in the lower back. And again, I can't emphasize enough the soft quality of your breath versus a really forced push, right? Our breath is a powerful tool that we carry with us wherever we go. So that soft breath, sending your breath into the areas of tension, can be very beneficial. Another tip that I have for you is practicing relaxed yet upright posture. I say the word posture, and I've been a PT for over 20 years. I know what most people do. It becomes this really forced, mechanical, almost militaristic upright posture, which actually can create more tension in your spine and create more pain. So if you are sitting right now, even take a moment and notice the position of your pelvis. When we're sitting, it's the position of our pelvis that affects the rest of what goes on with the spine up above. So you might even tip your pelvis forward and back to see if you can find a position where your pelvis is balanced. It's nice and neutral. And with your pelvis being really neutral, think of it being steady, almost heavy. And then the rest of your spine, if you could imagine, you might even close your eyes, imagining the rest of your spine being light, spacious. Those discs we looked at earlier, in between each vertebrae, you could almost imagine like those discs are filled with helium. So there's this spacious quality in your spine, almost as if the crown of your head's moving closer towards the sky. So there's a steadiness through the pelvis and lightness through your spine. That would be an example of relaxed yet upright posture. Sometimes a little extra support can be helpful, though. Maybe you put a pillow or two behind your back or on the couch. The couch is the worst. You know, it just swallows you up and it's squishy, right? So you might even sit on a firm pillow while you're on the couch and put another one or two behind you, or a lumbar cushion when you're in your car. You know, sometimes our body could use a little extra help in being in that upright position. Lastly, seek help sooner rather than later. I've mentioned earlier how those things we do to compensate when something hurts, they're not really a big deal at first, but over time they become our new normal. And it's all of us know with any habits or patterns in life, the longer those patterns persist, the longer it takes to kind of unravel those. And don't get me wrong, I've seen plenty of people who come in and say, I've been in back pain for 20 years. There are still things we can do to help. But if back pain is something that's fresh and new to you, then do seek help sooner rather than later. Okay, so if you've never been to physical therapy, I thought I'd just let you know a little bit about what we do in physical therapy because plenty of people have told me over the years that physical therapy can be scary or they're nervous about going to physical therapy because they don't want to get hurt, right? I can speak for myself in that I am on the ultra side of gentle when it comes to physical therapy. So nobody needs to worry that I'm going to be really too aggressive. But really, there are a lot of things out there that can help with back pain. I work hand in hand with chiropractors, massage therapists, acupuncturists. Um, all of those things are helpful. Physical therapy can be a nice add-on to any of those modalities. It's really not a one size fits all. And that's why I always really discourage you from Googling back pain and exercises and just choosing some exercises from online because they may not be the best fit for your body. It is not a one size fits all approach. Like I said earlier, it could be an imbalance in your hips that's really creating the pain in your back. So really what we do in physical therapy is kind of get to the root of things. We'll look at how you walk, how you move, look at which areas are flexible or maybe not so flexible. um, Assess areas that may be weak and need a little strengthening. And then from there, once we've determined what might be the root cause of your symptoms, then we can develop a program for you of some stretching, some strengthening, maybe some breathing, things that are tailored to you and your experience with pain. We can talk about more efficient ways to move and we can practice together because sometimes you go home and you're like, I don't know, am I doing this right? I'm not sure because it's hard to see your own body move, right? A second set of eyes can be really useful. We can teach you about pacing and body mechanics, not just for, normal daily activities, but also work, sports, other activities, gardening, things that you really enjoy, but you're not sure if you should be doing those things, or maybe you're having pain while you're doing those things. Safe exercises to do at the gym or at home, a little bit of both, right? Sometimes, not always, not everybody requires some hands-on approach, but sometimes it can be useful for us to incorporate some soft tissue work or some mobilization to nudge and help your body along a little bit in a gentle way. I'll use a lot of kinesio taping. You've probably seen athletes with the colorful tape all over their body. Sometimes we'll use kinesio taping. And then again, speaking for myself in particular, I do really enjoy infusing a lot of breath work, yoga, mindfulness things that really help soothe your nervous system as you're moving. But if that's not for you, I do not infuse this in everybody's treatment. But really, over the years, so many people have come to me saying, Michelle, yeah, I can't do yoga. I'm not flexible enough. Well, you don't need to be flexible to do yoga. It's much more than that. And I enjoy tailoring the practice of yoga to meet the needs of your body versus trying to bend your body to look like a certain position in yoga, right? So there's a lot of room to make things accessible for your body. Yeah, so one last little thing, and I'll look at the questions. So I'm here at Heart of Wellness, nestled amongst the trees here in Tumwater. I really, truly love what I do and love working with patients, especially there may be some of you out there who have tried physical therapy before and you're like, I don't know, it didn't really work, or oh, it hurt me worse, or I'd encourage you to give it another try. I truly do pride myself in taking a very gentle approach. And the space that I'm in is, if your nervous system is wired kind of on the tight side and you get anxious being around a lot of other people, I'm in a beautiful, quiet space that would just be you and me, which I love. So that can be really nice too, as you're going through your healing journey. Heart of Wellness, if you're not familiar with us, there are several different practitioners here in the building, and we do work really nicely and collaboratively. There are acupuncturists, several naturopaths, there's a dietitian, a massage therapist. Let's see, what am I forgetting? A couple of physical therapists. So, really, when you're coming here, you are coming here not as just somebody with back pain. When I'm working with you, I'm seeing you as a whole person. Being human is complex. There's a lot going on in our lives, and this is not a one size fits all approach. When you're coming here to Heart of Wellness, we're looking at your well-being as a whole. So there is information down below where we're located, phone number, etc. I would also encourage you to visit our website. There are a lot of resources on there, and you can also schedule your appointment online. So you don't have to call to schedule. Let me look at this chat here real quick. So somebody says, I'm going to finish PT next week. What's the best way to get into a gym workout program right out of PT? I would say the best advice I have for you there is, I'm sure in PT you've talked about your core muscles. Anything you do at the gym with resistance as far as weights, I would encourage you to first stabilize with your core and then go about whatever weight routine you're doing. But the best big picture advice I have for you, not knowing your specific situation, is to ease into it. Start with the lightest possible weight if you're using weights, and slowly ease your way into increasing repetitions and increasing weight. Very slow and gradual. If it's cardiovascular training and you're on the workout machines, like the treadmill or uh, like that, it'd be that slow, gradual approach. Maybe start with 5 or 10 minutes and just see how your body feels and slowly add from there. Let's see here. Anybody else have any other questions? Okay. Well, it's been great. Thank you all for attending today. If any questions do come up, again, you can see our website and where we're located if you just want to pop in and check it out. I do offer free 15-minute consultations. So if you're like, I don't know, maybe, I'm not sure, we can do a 15-minute phone consultation, or if you'd like to come in person, you can tell me a little bit about your individual situation, and then we can decide if it would be a good fit. So, so somebody asked about using a laser, and I will say, as a physical therapist, I am not trained in using lasers, so I do not know the answer to that question. I do know some chiropractors and others who use that as one of their modalities, but it's not something that I'm specifically trained in. So I have to say that that is out of my scope of practice. Does anyone else have any questions? Somebody asks about a yoga teacher to help. Absolutely. I am a certified yoga instructor, so I really enjoy if somebody's looking for a yoga practice, whether you're currently experiencing pain, I do see people and infuse yoga into your treatment sessions. If you're not currently experiencing pain and you really are just interested in learning more about the practice of yoga, I also do see cash pay clients who would like to come in for a private yoga session. But absolutely, yoga can be very beneficial in really working with the nice balance of flexibility and strength in your body. Okay, it's been lovely. Nice to see you all. Take good care of yourselves. And please, one last bit of advice is just to be gentle with yourself. We are all human. None of us gets anything right 100% of the time. And if you're having a rough go with your back right now, I just encourage you to please be patient and treat yourself with loving care, one little step at a time. Awesome. Thank you so much.